Hello, this is Dr. Bartosh of Proactive Wellness and Injury Center, and today I want to speak to you about being just that, being proactive. Because if you're proactive, you're going to be preventing things from occurring in your body. And as a matter of fact, over 90% of all of the diseases that we experience in humanity are totally preventable. So today I want to focus on a condition known as atherosclerosis. Now, it's a type of arteriosclerosis or arteriosclerotic vascular disease. In atherosclerosis, what happens is that the walls of the arteries actually become thicker. It's also known as hardening of the arteries. Now, atherosclerosis does this. It's the number one cause. The number one cause of all heart diseases, of strokes, and of other vascular disorders as well. Number one cause. Now, it's interesting because research has now shown us that in over 79% of the individuals that develop atherosclerosis, which leads to heart attacks, number one cause of heart attacks, strokes, and other vascular diseases, what the causative factor is a bacteria known as Chlamydia pneumoniae. Chlamydia pneumoniae. Now, this may sound foreign to you, but absolutely it is common to man. It's responsible, this same bacteria is responsible for common cold, for bronchitis, for sinus infections, for asthma attacks, for pneumonia. And you've got to ask yourself that if you are an individual who experiences frequent colds, has a lot of sinus infections that are recurring, or is subject to bronchitis or asthma attacks, you would do yourself well to have yourself checked, because as with most diseases, these things don't happen overnight, folks. What it is it's a gradual buildup in the system until, boom, you have this named disease, whatever it might be. And in this case, if the bacteria is developing in your system and is going on for years and years, after the sinus infections or the colds or the bronchial infections or whatever, you may have a heart attack, a stroke, or another type of vascular disease that in fact could have been totally prevented had you been proactive. So how do we engage in proactivity in this? This is what I'd recommend you do. What you'd want to do is, if you're going in for a heart test or for an exam on your heart, request that your doctor also do some lab tests. And you might check the fibrinogen, the ferritin, or the C-reactive protein. If any one of these three are increased, then you might or suggest to your doctor that he do a check for the Chlamydia pneumoniae. He can do a test to see if you have this Chlamydia pneumoniae in your system, because you may be asymptomatic. You may not have a heart problem yet, but the heart problem is developing. If you do the test and the test is increased, if you have high levels, then discussing it with your doctor, he or she can then discuss with you a program that they can put you on that will arrest or reverse this pneumonia, this bacteria from developing in you. And by doing that, being tested perhaps in a 6-month period after you engage in what they recommend, you can totally prevent and avoid this from ever happening to you. See, this is what we're all about, being proactive. We don't want to wait until something happens. We want to take the necessary steps to engage and prevent these things from happening. Because remember, in your body, if you want to maintain your health, the best thing that you can do is to remain proactive.